This video is for individuals who suffer from chronic neck and shoulder tension, or even pain. I'm going to give you the two-step solutions for it. Before that, we need to understand our ribcage and breathing mechanics better. Our ribcage expands and contracts when we breathe. Now that's a no-brainer. But do you know that there are movements on the inside that is driving this movement? And it's not only air entering the body that is causing this movement. From the MRI here, you can clearly see the movement of the diaphragm expanding and contracting. Now, along with it are the up and down movement of the other organs like liver, guts. Now, at the bottom, not shown in this MRI is the pelvis. As the organs move up and down, the pelvis is going through internal and external rotations. Now, it's basically open up its hands. This innominates here are like the hands, as if they are receiving the organs with open hands, and as you exhale, it closes back into internal rotation to push the organs back up together with the doming of the diaphragm to help expel the deoxygenated air in the lungs. Now let's take a look at someone whose breathing isn't optimal. Now look at how the ribcage is hardly moving as compared to the first video. You can even see that the shoulders are hiked up. And what is holding these shoulders hiked up? You guessed it right. The tight and neck shoulder muscles. So the common advice from physios and doctors is to stretch your neck and shoulder muscles. But do you see how that is not targeting the root of the problem? You can continue stretching your neck and shoulder muscles, but at best it's going to provide temporary relief. The real solution would be to restore better breathing mechanics. Now this is often met with violent objection from people who think that it's ridiculous to teach them how to breathe. Their retort will be, I've been breathing since the day I was born. Now, the two MRI examples that I gave you were perfect examples of how one individual who has better breathing mechanics as compared to the other. Now, as with anything, we can always do it better. People who think otherwise are ignorant. Don't be that person. So if you're someone who is constantly stretching your neck or trying to crack your neck to get relief from that constant ache, the next part is for you. My first step will be to use a foam roller, but not in a traditional way where you are just mindlessly rolling up and down. Now lay sideways on the roller and have your neck supported. Here you can see my head is supported by a pillow on top of a thick roller. You can use anything to hold your head up as long as it gets in a neutral position. Now the foam roller is placed directly under the armpit area while lying on your side. Position your arms in a way that the top hand is in front of the bottom hand. Take a gentle breath in this position. This will facilitate the expansion of the posterior part of the ribcage. Now as you exhale, begin slowly sliding your top arm back, and you initiate this movement by rotating your torso and keeping this movement as gentle and as relaxed as possible. Now people who are very tight and tense will want to move through this very quickly. So slow it down and think of doing this as lazily as possible. Once you hit end position where the top hand is actually behind your bottom hand, take a breath in and then gently exhale as you are moving back to starting position. Now do this exercise for 10 to 12 breath cycles. Repeat for 2 to 3 sets per day. Now what that exercise does is that it compresses the ribcage via the foam roller at different angles. Now this will help restore movement back into the ribs. As you saw in the MRI, the ribs weren't moving. This doesn't allow the expansion and compression of the ribcage. Next, I'm going to coach you through a breathing exercise that helps restore proper breathing mechanics. Use a pad or yoga blocks to elevate your knees. Now this gets you into an inverted position which facilitates the expansion or relaxation of the tight neck and shoulder muscles. Now knees should be positioned slightly behind the hips with your elbows directly under your shoulders. So finally, do a slight posterior tap by thinking of pulling your belt buckle towards your belly button. Do not overdo it. Just a little will do. And this position is where you are going to be breathing in. Use your elbows to gently push yourself away from the ground as you take a long, gentle inhale through your nose. Be very careful not to crunch up as you are pushing your elbows. Next, go for a long, gentle exhale by doing a big open mouth sigh, like so. Like you're trying to fog out a mirror. So with this exhale, you should feel your side abdominals engage. Now you hold on to these side abdominals as you take your next breath in. Repeat for 8 to 10 breaths and go for 2 to 3 sets per day. Many individuals I train have a tendency to go 100% of all exercises, and they end up feeling their neck and shoulder even more after this exercise because they are kicking on all the superficial muscles when they are breathing, and that defeats the purpose of this activity. So breathing exercise is meant to allow the superficial muscles to chill, allow expansion of the rib cage. Think about this, if the superficial muscles are holding and gripping on the rib cage, it doesn't give the ribcage an opportunity to expand. The tight areas will remain tight and your neck shoulder will remain tight as well. In the next video, I'll be going through some shoulder exercises that you can do to build on the strength and retain mobility. After we do these breathing drills, we must have something to follow up, so to retain it. So if this sounds like something that you're interested in, do help me subscribe to this channel, help share it to someone who will benefit from the content I put out. Gary from Penultimate Performance, signing out.